Welcome to the Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Welcome back to those of you all who are tuning in, and welcome to those of you all who are tuning in for the first time. Today we want to talk about growth through education. One of the biggest things that I see is that people don't necessarily know what we do from a physiatry standpoint, and as a result, to help grow your business, you're going to have to go out there and educate people in your healthcare community about what you do and how you can help them. Two biggest things: what you do and how you can help them. One of the most effective ways I found to grow my practice when I was starting out was to go to the acute care hospitals and really focus on educating the discharge planners and the case managers. So what I would do is I would talk to the head of the case management department, say, hey, I would like to do or sponsor an in-service, basically bring lunch, and I would go and basically first ask questions and then kind of educate on the role of the physiatrist in the acute care hospital and explain what we do and how we can help them. A lot of times I started out my talk by saying, hey, by show of hands, who knows what a physiatrist is? When I did that, I got crickets, okay? Crickets. No one, or nearly no one, knew what a physiatrist was or what we did and how we can help them. So one of the biggest things I was able to do was really figure out where they struggled, what their pain points were. Hey, Dr. Falandi, thank you for tuning in. So I figured out what their pain points were and where they struggled, and I explained to them how I can help make their life easier. So their big struggles or pain points were how to get patients out of the hospital as quick as possible. Now, that's changed a little bit in the post-COVID era because patients aren't going into the hospital, so they're afraid. But another pain point for them was readmission rate. So when the patients leave the hospital, they don't want these patients to bounce back within a 30 or 90-day period of time. So if you can find a way to help these patients leave the acute care hospital and not come back within 30 or 90 days, then you're making their life easier because they have certain metrics that they're being quote unquote graded on, or their work performance, job performance is based on. So I figured out how I can show them that I can help them decrease readmission rate and decrease length of stay. But like I said, now length of stay is not really as big of an issue because they just want patients to come into the hospital. So as a physiatrist, the key things you want to do are figure out who your case managers and discharge planners are, and you want to talk to them and explain to them how you can help them decrease length of stay and decrease readmission rate. Basically what you can say is, listen, as a physiatrist, I can come in, help assess patients in conjunction with the therapy team. You can explain to them that, hey, I know you guys have probably done things a certain way where you have the therapy team tell you what's the most appropriate level of care when a patient leaves the hospital. That's not necessarily the most ideal, or if that is done, it would be more beneficial to have a physiatrist, a rehab doctor who's trained in medicine but also function in rehab, help you figure out what's the most appropriate level of care for those patients. And I guarantee you, as you do that and people start to become more educated on what you do and how you can help them, your business is going to grow. And then once you target that particular area or individuals, then you can kind of be even more strategic in terms of figuring out other people in the hospital who you can educate to kind of help get you more involved in patient care in an acute care hospital and grow your business. So two big takeaways: identify who in the acute care hospital is kind of making that discharge decision. A lot of times that's your discharge planners and your case managers, and figure out how you can make their life easier. What are their pain points? What do they struggle with? And explain to them and show them how you can help them. So those are two big tips, or tip on how to grow your business through education. For more business tips, you can go to 62 Success, SIXTYTOSUCCESS.com. You'll get a free video series with me kind of explaining some other business tips. And then if you like that and you feel that it was helpful, you can sign up for a free 15-minute strategy call. We can get on that call, talk about all things rehab, and I can explain to you how or what I know to be next for you. So thank you for tuning into the Rehab Roundup. I am Dr. Hassan, board certified physiatrist, an independent practice owner. I help physiatrists start and grow their own independent practice so they can achieve financial independence and live without limits. Go to 62 Success to get more business tips. Look forward to talking to you guys soon.